Electric shock, you'll need to do a baby primary survey. If your baby is still in contact with the electrical current, turn the power off if you can, or use something non-metallic to break the contact, like a rolled up magazine or a wooden spoon. Try to see if your baby responds to you by gently tapping or flicking the sole of their foot and call their name. They are unresponsive if they don't respond to you. Martha, can you hear me? Next, you will need to check if they are breathing. To check for normal breathing, open the airway. Place one hand on your baby's forehead and very gently tilt their head back. With one finger, gently lift the chin to open the airway and check to see if they're breathing. If your baby is breathing, put them into the recovery position. Cradle the baby in your arms with their head tilted downwards. If your baby has suffered an electric shock and has stopped breathing, you need to start baby CPR. This technique is for use on babies under 1 year old. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. You may also need to treat burns, move them away from the source of heat, cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. This protects it from infection. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, break contact with the electrical current with something non-metallic. Check if they're responding and breathing. If your baby is breathing, then put them into the recovery position and call for help. If your baby is not breathing, start baby CPR. You may also need to treat burns, so cool the burn with cold water, remove your baby's clothing unless it's stuck to the burn, and cover the burn with cling film or a clean plastic bag. And that's how you treat a baby who has been electrocuted. Thanks for watching. Help support St John Ambulance. Donate today. As your baby crawls or toddles around exploring the world, they may come into contact with something that can burn or scald them. A burn is usually caused by dry heat, like a flame or a fire, a hot iron or sunburn. A scald is caused by wet heat, like steam or a hot cup of tea. If your baby has a burn or scald, you might see some of these signs. They may cry or have pain in the area. They may have a reddened, swollen patch of skin. They may have blisters, or they may have peeling skin. If you think your baby has a burn or scald, move them away from the source of heat. Cool the burn or scald by running it under cold water for at least 10 minutes. Don't use ice, gels or creams on the area. They can damage the affected skin and increase the risk of infection. Remove the clothing from around the burn. If the clothing is stuck to the skin, don't try to remove it. Cover the burn with cling film or a clean plastic bag. Get rid of the first few centimetres, place a single sheet over the burn and scrunch the edges, but don't wrap it around the limb. This protects it from infection. Always seek medical advice if your baby has a burn or scald. If the burn or scald is on the baby's face, hands or feet, or if the injured area is larger than the size of the baby's hand, or if it is a deep burn, then it's a serious burn or scald. Serious burns or scalds need emergency treatment, so call 999 or 112. While you wait for the ambulance, treat your baby for shock if necessary. So remember, move them away from the heat, cool the burn with water for at least 10 minutes, protect the burn with cling film, call 999 or 112 for an ambulance. And that's how you treat a baby with a burn or scald.
Baby starts to
Thanks
fall,
for watching.
They can bump their head on
Support St. John
furniture
Ambulance.
or other objects, and falls are common. Most of the time the injury will be minor and they might not even cry, but sometimes a bump to the head can be more serious. If your baby has had a minor head injury, they may have a bump or bruise to the head and a wound, but they are still able to respond normally. If you think your baby has a minor head injury, sit them on your lap and hold something cold against the injury to help the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. Do this for a maximum of 10 minutes. While you do this, try and assess their level of response. Are their eyes open? Are they alert? Can they respond to you if you talk to them? If they only respond to voice, they're drowsy. Do they only respond if you flick the bottom of their foot? Do they only respond to pain? Are they unresponsive to any of the above? If you are worried because they're not alert or because the injury is serious, then call 999 or 112 for emergency help. If they have any wounds, treat them by applying direct pressure to the wound and keep checking their level of response. If they've had a serious knock to the head, they may have a serious head injury and show some of these signs. They may be drowsy, they may have a headache, they may be dizzy, they may vomit, they may suffer a seizure or fit, there may be fluid coming from their ears or nose, and they may be unresponsive. If you know that your baby has had a severe knock to the head, or you notice any of these signs or think they're getting worse, you should call 999 or 112 for emergency help and tell them that you suspect a serious head injury to a baby. While you're waiting for help to arrive, try to keep your baby still in case they've suffered a neck injury. Check your baby's breathing and prepare to start CPR if they stop breathing. So remember, for a minor bump to the head, ease the pain and swelling with something cold and check their level of response. Treat any wound or bleeding if necessary. If you're worried or think it's a serious head injury, call 999 or 112 and keep checking your baby's breathing. Prepare to start CPR if necessary. And that's how you treat a baby who suffered a head injury. When your baby starts
Thanks
to
for
fall or
watching.
toddle around,
Help support
falls
St.
are
John
common.
Ambulance.
Most of the time the injury will be minor and they might not even cry, but sometimes the fall can be more serious. Once you've carried out a primary survey, you need to perform CPR if they are unresponsive and not breathing normally. However, sometimes a fall can cause other injuries, such as a broken bone or head injury. If your baby has a broken bone, you might see some of these signs. They may look in pain. They may not be able to move an arm or leg. There may be bruising or swelling. An area on the arm or leg may look deformed, bent, or shortened. If you think your baby has broken a bone, try to keep them still. Don't move your baby unless they're in danger. Then call 999 or 112 for emergency help. Support the joints above and below the injured area. Use your hands for this. Put soft padding around the injury for extra support. If necessary, treat them for shock by raising their legs, but don't raise the injured leg. While waiting for help to arrive, keep checking their breathing and whether they can respond to you. Sometimes a fall can cause a head injury. If your baby has a minor head injury, they may have a bump or bruise to the head and a wound, but they're still able to respond normally. If you think your baby has a minor head injury, sit them on your lap and hold something cold against the injury to help the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. Do this for a maximum of 10 minutes. While you do this, try and assess their level of response. Are their eyes open? Are they alert? Can they respond to you if you talk to them? If they only respond to voice, they're drowsy. Do they only respond if you flick the bottom of their foot? Do they only respond to pain? Are they unresponsive to any of the above? If you are worried because they're not alert or because the injury is serious, then call 999 or 112 for emergency help. If they have any wounds, treat them by applying direct pressure to the wound and keep checking their level of response. If they've had a serious knock to the head, they may have a serious head injury and show some of these signs. They may be drowsy. They may have a headache. They may be dizzy. They may vomit. They may suffer a seizure or fit. There may be fluid coming from their ears or nose, and they may be unresponsive. If you know that your baby has had a severe knock to the head, or you notice any of these signs or think they're getting worse, you should call 999 or 112 for emergency help and tell them that you suspect a serious head injury to a baby. While you're waiting for help to arrive, try to keep your baby still in case they've suffered a neck injury. Check your baby's breathing and prepare to start CPR if they stop breathing. So remember, if your baby has had a serious fall, perform a primary survey. If your baby is unresponsive and not breathing, call for help and ask a helper to call 999 or 112 for emergency help. If you are on your own, use a mobile on speakerphone so that you can start CPR as soon as possible. If you do not have a speakerphone, do CPR for 1 minute before calling for emergency help. If you think your baby has broken a bone, keep them still, support the limb and call 999 or 112 for an ambulance and keep checking their breathing and level of response. If you're worried or think that it's a serious head injury, call 999 or 112 and keep checking your baby's breathing and prepare to start CPR if necessary. And that's how you treat a baby who's had a serious fall. Thanks for watching. Help support St John Ambulance.
If your baby is unwell and has a fever, it can be very worrying. If you think your baby has a fever, there are 6 key things to look for. Early on, you might notice a high temperature, above 37 degrees Celsius. They may have pale skin. They may feel cold, with goose pimples, shivering and chattering teeth. Then later, you might notice hot, flushed skin and sweating, a headache and general aches and pains. Take your baby's temperature using a thermometer. If it is above 37 degrees Celsius, it's a fever. Help make them comfortable and don't overdress them or remove too many clothes. Don't cool them down so much that you're making them shiver. Give them regular drinks. If they're breastfed, feed them regularly. And you can offer them water to drink. This will help keep them hydrated and replace any fluid they may lose from sweating. If your baby is distressed, you can give them the recommended dose of paracetamol. Remember, always check the information on the container and don't give aspirin-based medicine to anybody under the age of 16. Check your baby frequently, including during the night. If you're worried about their condition, they have a seizure or fit, then call 999 or 112. A temperature above 38 degrees Celsius is unusual under 3 months, or over 39 degrees Celsius above 3 months. Call for a doctor or NHS Direct for advice. If they seem to be getting worse, then call 999 or 112 for an ambulance and be prepared to treat them for a seizure. So remember, check their temperature and keep them cool. Give them plenty of fluids. If their temperature is over 38 degrees Celsius for a baby under 3 months, or above 39 degrees Celsius in a baby over 3 months, get medical advice. If they're getting worse, call 999 or 112. And that's how you treat a baby with a fever. Thanks for watching. Help support St John Ambulance. Donate today.
As you start weaning your baby, small items of food may get lodged in their throat and they may choke. They can also choke on small toys or household items. If a baby under 1 year old is choking, you'll notice that they'll be unable to cry, cough or breathe. What we're going to do now is administer some back blows. So first of all, you need to lay your baby face down along your thigh, making sure you support their head and their neck. Next, we're going to administer those directly between the shoulder blades using the heel of your hand. Give up to 5 sharp back blows, making sure after each one, whatever it is, hasn't come out. If the back blows don't work, we now need to move on to giving some chest thrusts. So we need to turn them over so they're lying face up, again making sure that their head and their neck are supported. Put 2 fingers in line with the armpit in the centre of the chest, and pushing down sharply, administer up to 5 chest thrusts. If this doesn't work, call 999 or 112 for emergency help. Repeat 5 back blows and 5 chest thrusts until help arrives. If they become unresponsive, you will need to start CPR. So remember, if your baby is choking, check the mouth, slap it out, squeeze it out. And that's how we treat a choking baby. Thanks for watching. Help support St John Ambulance. Donate today.
Babies have lots of fun at bath time, but with any amount of water there's always a risk of drowning. As your baby crawls or toddles around, they may end up other places where there is water, such as swimming pools or lakes. If you think your baby is drowned, before starting CPR, move them away from the water and lie them on their backs, ideally on a raised surface such as a table. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the centre of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. If your baby starts to breathe normally again, then we need to put them into the recovery position. Cradle your baby in your arms with their head tilted downwards. Then call for an ambulance. Keep checking your child's breathing, pulse and level of response while you wait for help to arrive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs covering both the nose and mouth, then 30 chest pumps with 2 fingers to the centre of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you give CPR to a baby that has drowned. Thanks for watching. Help support St John Ambulance. Donate today. Also known as a convulsion or fit, can be caused by raised body temperature linked to throat, ear or other infections. It can occur because the brain is not mature enough to deal with the body's high temperature. When a child is having a seizure, you may find they have
loss of or impaired response, vigorous shaking with clenched fists and an arched back, signs of a fever with hot, flushed skin and sweating, breath holding and red, puffy face, possible vomiting, or a loss of bowel or bladder control. If you think your child is having a seizure, place pillows or soft padding around the child so they don't injure themselves on surrounding objects. Do not restrain them. If they have a raised body temperature, try and cool the child by removing any bedding and clothing, although you may have to wait until the seizure stops to do this. Ensure there is fresh air, but make sure the child doesn't get too cold. When the seizure has stopped, open the airway and check their breathing. If they are breathing, put the child in the recovery position, call 999 or 112 for emergency help. While you wait for help, reassure the child and monitor their level of response. So remember, place padding around the child and don't restrain them. Try and cool them down. When the seizure has stopped, open their airway and check their breathing. If they are breathing, put them in the recovery position and call 999 or 112 for emergency help. And that's how you help a child having a seizure. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
Their little fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a broken bone. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. Now we're going to move on to wrist and forearm injuries. If your baby has injured their wrist or forearm, these are the things to look for. The area may be tender and there may be swelling or bruising and they may feel pain in the area. It can be difficult to know if your baby has a sprain or a fracture, but if you think your baby has a wrist or forearm injury, take the following steps. Remember, RICE. Rest. Help your baby to sit or lie down and support their arm in a comfortable raised position. ICE. Apply something as cold as your baby can bear. This could be a cold flannel, an ice pack or frozen peas wrapped in a cloth. Leave the ice pack in place for no longer than 10 minutes. Comfortable support. You could wrap a soft layer of padding like cotton wool around the area. And elevation. Keep your baby's arm raised with something soft like cushions or a rolled up blanket. Call your doctor or see a nurse if your baby is in severe pain or they can't use their hand or wrist at all. If your baby is in a lot of pain, you can try treating them with the recommended dose of paracetamol. So remember, for hand or finger injuries, sit or lie your baby down and raise the injured hand. Wash any cuts and cover the wound with a non-fluffy dressing. Pad the hand with something soft. Call your doctor if you have any concerns. For severe pain, you could give the recommended dose of paracetamol. For wrist and forearm injuries, remember RICE. Sit or lie your baby down and raise the injured arm. Apply ICE. Support the arm and keep the arm raised. Again, call your doctors if you have any concerns. For severe pain, you can give the recommended dose of paracetamol. And that's how you treat a baby who has hurt their hands or their arms.
Poisons could
Thanks for
include
watching.
chemicals,
Help support
drugs,
St John Ambulance.
plants,
Donate.
fungi and berries. There are 5 key signs to look for if someone has swallowed a poison. They may have nausea and vomiting, which can sometimes be blood-stained, cramping abdominal pain, a burning sensation. They may show a decreased level of responsiveness or even have a seizure. If someone has swallowed a poison and they are responsive, ask them, "What have you swallowed? How much did you swallow? And when did you swallow it?" Look for clues such as poisonous plants or empty packaging. Reassure them and call 999 or 112 for emergency help. Give ambulance control as much information as you can about the poison, as it will help to treat the casualty. While waiting for help, monitor their level of response and keep reassuring them. If the poison they've swallowed has burnt their lips or airway, give them sips of water or milk. If they should vomit, try to keep a sample in a bag or container to give to the ambulance personnel. It may help them to identify the poison. Do not try to make them vomit. If they become unresponsive at any time, be prepared to treat an unresponsive casualty. So remember, when treating someone who has swallowed a poison, ask them what they have swallowed, how much and at what time. Look for any clues. Call 999 or 112 for emergency help. While waiting for help, reassure the casualty and monitor their level of response. And that's how you can help someone who has swallowed a poison. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. People may faint as a reaction to pain, exhaustion, hunger, or emotional stress. It may also happen after someone has been standing or sitting still for a long period of time, especially if they are hot. When someone faints, their pulse slows right down, but it usually picks up again quickly and goes back to normal. If someone has fainted but doesn't come round after a couple of minutes, then this could be more serious. There are 3 key signs of someone who has fainted. They have a brief period of unresponsiveness, causing them to fall to the ground. They may have a slow pulse. Their skin may be pale, cold and sweaty. If someone's feeling faint, advise them to lie down. Kneel down next to them and raise their legs, supporting their ankles on your shoulder or a chair if available, to help blood flow back to the brain. Watch their face for signs that they are recovering. Make sure that they have plenty of fresh air. Ask bystanders to move away, and if you're inside, ask someone to open a window. They should recover within a couple of minutes. As they recover, reassure them and help them to sit up slowly when they are feeling better. If they don't become responsive again, quickly open their airway, check their breathing, and prepare to treat someone who is unresponsive. So remember, if someone's feeling faint, lie them down and raise their legs. Make sure they have plenty of fresh air, and when they recover and are feeling better, help them to sit up slowly. If they remain unresponsive, prepare to treat an unresponsive casualty. And that's how we help someone who's feeling faint or have fainted. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate.
If you think someone has had a head injury, there are 6 key things you may find. They may have become unresponsive, even if for a short time. There may be a scalp wound. They may complain of dizziness or nausea. They may have memory loss of events at the time of the injury or before the injury occurred. They may complain of a headache. They may be confused. If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain? If you pinch the earlobe, do they open their eyes? U, Are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head whilst playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Headaches are not usually serious and can be treated at home. Common causes include tiredness, stress, an illness such as flu, or exposure to hot or cold temperatures. But headaches can be a sign of a more serious problem, like meningitis, head injury, or stroke. If someone has other symptoms, or it's following a blow to the head, be sure to seek medical advice. If someone has a headache, help them to lie or sit down in a quiet place and give them something cold to hold against their head. This could be a cold compress, it could be an ice pack, or a bag of frozen peas wrapped up in a cloth. Be sure not to leave it on for longer than 10 minutes. For adults, you can suggest they take the recommended dose of painkillers such as paracetamol. For children, you can give them the recommended dose of paracetamol syrup. If someone has other symptoms such as fever, vomiting, a stiff neck and sensitivity to light, be sure to seek medical advice immediately. Or if they become unresponsive, call 999 or 112 for emergency help and prepare to treat an unresponsive casualty. If they have a headache following a head injury, if the headache is not settling or their condition is getting worse, they should also seek medical advice immediately. Remember, get them to lie or sit in a quiet place. Help them to take the recommended dose of painkiller. And if you are concerned, seek medical advice. That's how we treat a headache.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligrams, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers, and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound. If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot and then wrap it around 1.5 times just to make sure that it doesn't come off. I'm just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting the head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel down by the child beside their chest. Place only 1 hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure. Allow the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast, and to help you, you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help.